Hi, I'm Dr. Mohit Saraogi and welcome to the next edition of Online Fertility Training. I thank you for choosing International Fertility Academy as the preferred means enhancement of your professional knowledge. Today, we are going to discuss ovum pickup. In part 1 of the course, we will try and cover various modules. We will discuss 1. What is oocyte? Next, what is oocyte retrieval or ovum pickup? So what exactly happens to the oocyte when we inject HCG to the patient? Coming to the position of the patient, the scan machine, the suction apparatus and the assistant. During the procedure, the patient is under IV sedation, usually in lithotomy position on the bed, with legs strapped to the stirrups. A freeze-all cycle is usually preferred in situations where 1. We have more than 15 eggs that have been retrieved. 2. Where the agonist trigger has been given to the patient. This is a very interesting paper which shows that most clinicians became proficient at ovum pickup by the end of 20 aspirations. I hope the tutorial has given you the key points which you can use in your day-to-day practice to improve the quality of your work as well as your standard of treatment and care that you give to your patients. We look forward to seeing you in the next tutorial.